Hello and welcome to our listeners. Thank you so much for joining us on this segment of the UVA Mini Med School special podcast, COVID-19 in Charlottesville. My name is Jessica Little. I'm a fourth year medical student at the University of Virginia, the class of 2021, as well as a student in the medical scientist training program. And on this segment today, we're excited to discuss with you what the Charlottesville community and UVA in particular has been doing to protect our vulnerable populations during the COVID-19 era. As you all may know, anyone can develop severe disease from COVID-19 infection, but certain populations are more at risk. This includes older adults, residents of senior living communities, as well as persons with multiple comorbidities. And these vulnerabilities pose challenges both to these individuals as well as those who love and are caring for them. Here to speak with us today, I'm excited to have the pleasure to welcome Dr. Laurie Archbald. She's an associate professor of geriatric medicine at UVA. She's also medical director of the UVA Geriatrics Outpatient Clinic at the Jefferson Area Board of Aging. And she's really leading UVA efforts to meet this pandemic and respond to it in our geriatric communities. So thank you so much for joining us today, Dr. Archbald.
Thank you for having me.
To start with, I wanted to just have you tell our listeners a little bit about what your involvement has been with efforts to protect Charlottesville senior communities during this COVID-19 pandemic.
Certainly. Well, we've been really working with our patients in many different ways, from our clinic patients, so in our outpatient clinic, working with our patients very early on in terms of counseling about prevention, about how to stay safe, and what we do know and understand about this virus, and what we can each do individually to decrease our risk of contracting this virus. And so working with our outpatients in that regard. Then as the pandemic started to unfold and we're doing more social distancing, talking a lot about how to avoid social isolation and how to stay engaged in the community, which may sound a little counterintuitive. How can you be social distancing while still staying engaged? But there are ways to do it, and working with our patients to try to make sure that we're staying engaged is very important. And then also working with our local facilities to help in terms of preparation for the pandemic and avoiding infection getting into the facility. And then if it does, what do you do?
Okay, great. Thank you so much for sharing that with us. And I think you were just kind of going into, it's inevitable that some cases and outbreaks will occur in Charlottesville. And when those have happened, what has the UVA response been?
So we've been engaged in very close discussions with many of our local post-acute long-term care assisted living facilities over the past few months to really focus on prevention and to focus on preparing and optimizing infection control and being able to share what we know and think through how to best optimize this in the facility. In the cases where there have been outbreaks and around the community, we have a telemedicine response team in collaboration with geriatrics as well as pulmonary and critical care and our nursing colleagues and the telemedicine department to be able to respond quickly if a situation arises, and to be able to do a needs assessment in the facility in terms of what is needed in the facility. If there is an outbreak, to review daily with the providers on the ground in the facility, the nursing staff and the physicians or the nurse practitioners in the facility, to go over the patient vital signs. How are they doing? Are they doing okay? Are there signs of illness that may come up that may be very subtle, and how do we intervene early to try to make sure that people are doing well and getting as much support as they can. And we've had great collaboration with local facilities and wonderful nursing staff and providers and facilities that we've been working with who've been doing a phenomenal job. And then we're there to add additional assistance, additional subspecialty support if needed, which we can do virtually via telemedicine, which is a video component, an audio component, and then having things like a virtual stethoscope and being able to listen to the patient's lungs as well, or heart, and do other parts of the exam. So that's been very beneficial in trying to optimize care of patients in facilities, and then if needed, helping to coordinate hospital transfer too when that's appropriate.
Wow, that response team sounds phenomenal. And I know I speak for everyone in saying that we're so grateful that you are involved with those efforts and that so much outreach is being done. Just pivoting a little bit, and you touched on this earlier, many individuals, and especially our vulnerable populations in our community, have found their day-to-day lives really significantly disrupted due to the important social distancing measures that have been put in place. How do you see this prolonged isolation impacting our senior community members' mental and physical health?
Yeah. Well, social isolation is something that we have focused on in geriatrics even before COVID. There have been a lot of research studies over the past really decade or more that point to not just the emotional or mental health impacts of social isolation, but also physical impacts and impact on medical conditions as well. And so in geriatrics, we've always focused on, if somebody is getting older or perhaps becoming less connected with the community because of age or decreased transportation or other issues, to really focus on how to keep that person engaged in the community. Of course, COVID came around and it changed a lot of that, in that we have to stay physically separate to decrease our risk of getting infection. And so it takes really a lot of creativity to think about, well, how can we still stay engaged in the community? There are a lot of different ways that people can, and that we talk with our patients about how to stay engaged in the community. Technology is one option. So things like we're doing now and having chats on Zoom. I know a lot of my patients have been, as have I, been newly learning about Zoom and how to kind of become Zoom experts in a sense, to connect with other people. And so there, many platforms for that. Sometimes on the smartphone, you can do it very easily with kind of a click of an app as well. So for patients that don't have the technology or don't feel comfortable with the technology, there are other options too. In terms of staying connected, having a conversation is very, very important. The video component is nice if we can do it, but talking with somebody. So a landline or a flip phone work just as well in terms of staying connected. And both for our patients, encouraging them to reach out, our older members of the community to reach out, but also all members of our community to reach out to people who may be more socially isolated, and to check in on them remotely and with a phone call, and to see what we can do to help. Can I go to the grocery store for you? And can I help you pick up your medications if you're not getting delivery? What can I do to help as a community member? But also equally important as being helpful is also being present. And so even just calling to check in and just listen, and just creating intergenerational dialogues to just be present with someone, even if it's on the phone, and to just communicate and to just have that human connection that all of us crave is really important. And we can do that on the phone. It's not as ideal as if it were in person, but that's not always an option right now. And so reaching out in the community is a really important piece of it.
Great. Thank you so much for sharing with us those ways that people are staying connected in our community. That's great. Just kind of wrapping up, moving forward, what advice do you have for our community members, both those in the vulnerable populations as well as others, to protect their physical and mental health and connect with each other as they navigate through this crisis?
Well, I think foremost, staying informed and knowing what's going on is really important. Listening to our public health and health experts in terms of recommendations, policies, and what we need to do to stay safe. And balancing that with not having a constant news cycle, continuously watching breaking news after breaking news after breaking news can be very anxiety provoking and not really provide us with all that much more information. So being in control of how we get our information is important in terms of, perhaps carving out times during the day when you're going to check in and get the updates to see what's new and different, perhaps in the morning and the evening, and then finding what you do joyful during the day. So staying informed is important, staying connected is important, but also being in control of how you get that information.
Very wise words, Dr. Archbald. Well, thank you so much for speaking with us. I know I speak on behalf of everyone when I say we're so grateful for your efforts on the front lines to protect our vulnerable communities and geriatric populations during this really unprecedented time in our history. Thank you for sharing our insights, and I'm sure everyone like me feels better informed.
Thank you for having me.
Thanks.